Hello emergency department physicians. The control period of the Syncope study is now complete. Thank you so much for your support. We are now in the intervention period where we will be using the Canadian Syncope Risk Score, which was developed by your very own Ottawa-led Canadian team. During the intervention period, we recommend using the Canadian Syncope Risk Score-based practice recommendations as much as possible. For more information, please refer to the Canadian Syncope Pathway poster displayed in the emergency department. This study will assess health resource utilization before and after the implementation of the Canadian Syncope Risk Score-based practice recommendations. As this is part of clinical care, no patient consent is required. To identify potentially eligible patients, the triage desk will attach a laminated pink slip with the words Syncope Study on the patient's chart. Within the chart, you will find a pink form to complete. The Canadian Syncope Risk Score practice recommendations should only be applied on patients over the age of 18 presenting to the emergency department within 24 hours of true syncope. Remember that true syncope is a transient loss of consciousness followed by a spontaneous complete recovery. The Canadian Syncope Risk Score should not be applied if the patient did not suffer true syncope or meets any of the exclusion criteria listed below. Furthermore, the recommendations should not be used if a serious underlying condition is identified during the emergency department evaluation or if the patient is hospitalized for a reason unrelated to syncope workup, for example, unable to cope at home or for pain control. Here's a quick tip. Troponin testing can be skipped if all of the following 5 ultra-low risk criteria are fulfilled. Age less than 50 years. No history of heart disease. Normal triage systolic blood pressure between 90 and 180. Normal electrocardiogram. And lastly, if the clinical impression is non-cardiac syncope. Now, let us look at the Canadian Syncope Risk Score itself. There are 8 predictors in 4 categories. Clinical evaluation, electrocardiogram, lab results, and presumed emergency department diagnosis. Clinical evaluation. Did your patient have a predisposition to vasovagal symptoms, history of heart disease, or abnormal systolic blood pressure during the emergency department stay? Electrocardiogram. Does your patient have any of the following electrocardiogram abnormalities? Lab values. If a troponin was drawn, was it elevated? A positive troponin value is above the 99th percentile or 14 nanograms per liter if high sensitivity. If a troponin was not measured either because the patient fulfills the ultra-low risk criteria or you chose not to measure it, select Not Done. Diagnosis in the emergency department. Lastly, what is your diagnosis at the end of the emergency department visit? Vasovagal syncope, cardiac syncope, or other. Please select only one of the 3 options. On the pink form, assess if the Canadian Syncope Risk Score predictors apply to your patient. If they do, please apply the appropriate amount of points on the right-hand column. Then, tabulate the total score. The Syncope Risk Score ranges from -3 to 11. Patients are stratified into low, medium, or high-risk categories. The CSRS provides recommendations about outpatient monitoring and hospitalization. The cardiophone packages can be found in locker 23 in the physician's lounge. The locker will be unlocked. If the patient is discharged with cardiac monitoring, please retrieve the cardiophone from the physician's lounge and write the device number on the form. Hand the form directly to the ACC desk to fax to the central monitoring station. Please give the package to the patient. All necessary information is inside, including device hookup instructions and contact information for the research team and the monitoring center's 24/7 hotline. If the CSRS practice recommendations are not followed, please specify the reason why on the back of the form. After completing the form, place it in the designated Syncope Study bin at the ACC desk. We would like to conduct a 30-day follow-up and use leftover blood for cardiac biomarker testing. For this part, we request that you obtain verbal consent from the patient. If the patient refuses, please indicate so in the form. Here are a few tips from the research team. Complete the form accurately at the end of the emergency department visit. No consent is required except for the 30-day follow-up and testing of leftover blood. Please remind patients discharged with cardiac monitoring that they will receive a phone call the next business day. Thank you for watching and contributing to Syncope Research.